Hello, knowledge enthusiasts. Welcome to Mind Nuggets, your daily mental snack. Here we dive into the fascinating world of bite-sized knowledge and facts that will expand your knowledge day by day. The COVID-19 pandemic has shown us how important the global healthcare system is. But in this chaos, a new medical technique was born that is revolutionizing the vaccination sector. We are talking about the RNA vaccination method. Today, we will get an insight into the principle of this new type of vaccine, see the differences between traditional and RNA vaccination, and highlight some of the advantages and disadvantages of this method. How does the RNA vaccine work? RNA vaccines, such as the one developed for COVID-19, work by introducing a small piece of genetic material, called messenger RNA, mRNA, into the body. This mRNA contains instructions for the cells to produce a protein that triggers an immune response. Let's look at the process step by step. The vaccine contains a small piece of synthetic mRNA that encodes information about a specific part of the virus, such as the spike protein on the surface of the SARS-CoV-2 virus. When a person receives the vaccine by injection, the mRNA is taken up by the cells near the injection site. The cellular machinery, more specifically the ribosomes, reads the mRNA and synthesizes the spike protein, which in itself is harmless. This process is called translation. This newly synthesized viral protein is recognized by the cell as foreign, which triggers a cellular mechanism that presents the spike protein on the cell surface. This presentation signals to the immune system that there is a potential threat. The immune system recognizes the presented viral protein as foreign, even if it is not the entire virus. This triggers our body's natural immune response, which leads to immunity against the viral threat, and allows for a quick and specific response when the person is later exposed to the actual virus. Traditional vaccination versus RNA vaccination. In traditional vaccination, the virus or bacterium responsible for a disease is isolated and weakened or inactivated. The resulting vaccine is then administered to stimulate the immune system and encourage the production of antibodies and memory cells for long-term protection. The process undergoes rigorous testing, including clinical trials, to ensure safety and efficacy before it is approved by the authorities and widely distributed. Advantages of RNA vaccines. 1. mRNA stability. The mRNA used in vaccines is not stable for long. It is rapidly degraded in the body. This means that it does not remain in the body permanently. 2. No live virus. RNA vaccines do not use live virus particles. They only contain the genetic instructions to produce a small part of the virus that cannot cause the disease itself. 3. Rapid development. RNA vaccines can be developed more quickly than conventional methods, as there is no need to grow large quantities of the actual virus or use attenuated forms of the virus. 4. Flexible. The same RNA platform can be adapted relatively quickly to different viruses by changing the encoded genetic information. Disadvantages of RNA vaccines. 1. Storage requirements. RNA molecules are generally less stable than traditional vaccine components. RNA vaccines often require strict temperature controls, making storage and transportation difficult, especially in regions with limited access to modern cold chain infrastructure. 2. New technology risks. RNA vaccine technology is relatively new, and its long-term effects are still being studied. The novelty of the approach may lead to concerns about unforeseen side effects or unknown risks that could arise with prolonged use. 3. Manufacturing challenges. RNA vaccine. Manufacturing can be complex and may require advanced technologies and expertise. Scaling up production to meet global demand, particularly in the event of a pandemic, could be challenging compared to more established methods of vaccine production. 4. The mutability of RNA viruses. RNA viruses, such as influenza viruses, are known to mutate rapidly. While RNA vaccines can be adapted quickly, the constant evolution of the virus may require regular updates to the vaccine to maintain efficacy. Conclusion: RNA vaccines represent a breakthrough technology that has proven to be highly effective and safe in protecting against infectious diseases such as COVID-19. The success of these vaccines has paved the way for further research into mRNA technology in various medical applications such as oncology or Alzheimer's disease. Do you like this morsel of human knowledge? Drop us a comment below to tell us what other topics you're interested in. See you next time.